Thanks for that. As most of people said before me, it's really inspiring to be here. It's fantastic what you're doing. Thanks for that. I have a short presentation what we are doing in the Netherlands. And I don't think I will tell a lot of new things, but I think, anyway, I will tell what we are doing and hopefully there's something to exchange. I'd like to start with a question to you, which you might probably already know. I guess I sometimes ask this question to people around me. There's a study being done in the UK some time ago about the percentage of children who are going to outside and listen to birdsong, and the number of children that never or almost never do that. Do you have any idea? Well, I didn't, but it's 70%. 77% of the children don't go outside to listen to the bird songs. And a similar issue is with looking at the sunset, to the sunrise. It's only 90%, and I think that's really shocking. This is a picture of my wife in the metro, and well, not she's the one behind. She doesn't know that I'm showing this picture, but this is the normal, life that we're having at the moment. And this is how my wife and I. This is the hair of my wife in the area where I live. This is how we like to live, to be incorporate in everything around us. A little bit, very short about myself. I'm educated in business administration and ended up in nature conservation. I'm now working on two things. One is a large program in the Netherlands to promote nature-based solutions. And we look at the economics behind that, how to make nature-based solutions economically viable. It's a very large program, very proud of it. 150 million euros we can spend the next 10 years to work that to a next level. And the rest of my time, I also work on earthfulness, which is sort of mindfulness, all the things that you talk about, and as a program to integrate nature more in our daily lives. And as such, I was asked to become president of the Nature for Health organization, which I'm representing now. We exist now 10 years, and we're really looking for integrating the nature sector ambitions with the health care sector ambitions, I could say. And in the Netherlands, it's probably also in your countries, but in the Netherlands, the divisions between these two bubbles, I would say, is huge. I mean, this is a picture of a hospital in the Netherlands, and I'm sure you have similar pictures. There's really absolutely nothing natural about it. And this is also a picture of a nature or a place in the Netherlands where there's so many people now going outside into nature nowadays from cities, that they're actually, kept out of nature because, there are too many people. So the biodiversity is really under threat. And I think we as human beings in the Netherlands we are becoming really crazy. We are getting nuts, really. The division between these two worlds is completely too far. We need to find back ways how to integrate these stories more. I don't need to explain this to you. I'm sure you understand what I mean. And if you look to the Netherlands, to these two different sectors, if you look at the main challenges in the healthcare, it's really the rising healthcare costs with the aging situation, aging population. Now it's already the largest amount of money spent of the government is on healthcare. And you can see it rising and getting worse. And in the end, we won't be able to afford it. The demands on mental health, that what we're talking about now for the younger generation is really suddenly in the last 2 years recognized as a major issue. Before nobody saw it, but now it's really signaled as a major problem. We have long waiting lists in the whole of the healthcare sector, but especially on mental health. and the healthcare workers in the sector, a lot, and it's really a recognized issue, are overloaded and demotivated. At the same time, in the nature sector, there's the NGOs and the organizations who are managing nature reserves. They see the biodiversity in the Netherlands really decreasing incredibly quickly. We have I mean, the recent report is the number of butterflies is 4 times less than it used to be 10 years ago. 10 years ago, really, it's really going fast. And at the same time, we are confronted with a very polarized society where there are now increasing number of people, if you mention nature, then they somehow think that they have to be against it, like the farmers and nature discussions that you can also see in the rest of Europe. It's especially also in the Netherlands very alive now. These are big challenges. Now, if you look at these challenges, then the opportunity for combining forces of the nature sector, so to say, NGOs and environmental organizations working together with healthcare is so obvious. But I have to say, it in the Netherlands is very limited still. It's really on a very low scale. And why is that? And in our evaluation, in our discussions, we mentioned 3 things. The protocols in the Netherlands for the healthcare sector are very strict and very written out, and it's very much excluding nature and very sterile instead of natural. Also, if you want to translate a good some good results of things what you have been presenting now, from ecotherapy to these kind of examples, if you want to put it into practice, it's so complicated. The health sector in the Netherlands, I'm not sure in your countries, but it's so incredibly complicated that you don't know where to start. There's so many regulations and organizations, institutions involved, so it's very complex. And meanwhile, the green sector, where I have my background in the last 20 years, health issues are it's nice, but it's not really being worked on. It's not it's not seen as a core issue, because their core issue, as the main NGOs see that, is biodiversity. So what would we need to make a change in this? How can we increase the cooperation? Obviously, we need more coalitions, I think, between organizations from the healthcare sector and organizations from in the nature sector. That is not there. It's a little bit starting. This organization, Nature for Health, is one of the examples, but it's very small still. We need more integrated area-oriented policies, where you can, in an area, you can bring both together, right? If you really focus on a community or on a municipality, then it's getting more concrete. You can look for opportunities to cooperate, and then have practical examples which shows like they work, like you were talking about in UK and in Greece. That's fantastic. I'm really, it's inspiring to hear these examples. But I also think that if we really want to do this, we need a paradigm shift in thinking in the Netherlands, because now the world, and I know this from experience, from people working on the nature sector, the forest managers, are a completely different language and culture than the doctors in a hospital, for example. They are different worlds, and if before we integrate them, that will take a while. I use a slide from Annette Posma, a colleague of mine here in the Netherlands, where the cultural differences between the nature sector and the healthcare sector is really big. In the nature sector, people who work there are used to work out their own ideas. From idealism, they start, and it's something, that's how they work. And in healthcare, it's much more evidence-based. It's a protocol. This is how you work, etc. Nature organizations are usually small organizations, and there's also feeling with these people They feel like a mouse, while the healthcare sector is full of large organizations, which is more like the elephant, so to say. There's also that feeling. In healthcare, people are working really hard, and that's the workload and regulatory pressures are the main issue. Whilst many major organizations in the Netherlands are daily struggling to get funding and even to exist, so to say. In healthcare, it's very important to be accountable to what you do, whilst nature organizations are more working on acquisition. In nature organizations, there's a feeling of competition with other organizations, and promotion and communication are key instead, or coordination based on stories and it's based on stories and trust. Whilst in the healthcare sector, that's not really a priority. And yeah, it's more worked on coordination based on the facts and the protocols. So, long story short, it will take a while before these two worlds come together. As business administration person, I like to use graphs and models, and this is a model of a transition. Transition has always two sides. You need to build up new habits, or a new protocol, or a new pattern you have, and you have to work out an old one. And we are used to do the building up, but we always forget to work also on to work out the old pattern, so to say. But if you look in where we are in the Netherlands on this issue now, if we want to go from a sectoral approach to a joint reciprocal approach, where nature helps health of people, and health can also help restoring biodiversity, then we see that we are still in experimentation phase. We have forest bathing issues, initiatives, nature coaching, earthfulness, eco-humanism, nature for health, but it's all very much still on the experimental part. Just a little bit more information what we as Nature for Health are doing. We are trying to scale up experiments now with the green mental health institutions. It's called in the Netherlands, it's the GGZ. I'm not sure how to translate it, but it's institutions for mental health, so to say. And there are like more than 100, but the ones who are most eager to also work on green mental health practicing, they come together now and they help each other to come further. And since 1 month, we know that we also get funding to increase this. And so this is really hopeful, and we're working on it to really make this a better, to help these organizations to green their facilities. And we do that with expertise, and we do that also with, well, I can tell a little bit more about it in a minute. And we also work on the nature on prescription, what our colleague from the UK was also talking about. If you talk about the green mental health institutions, so what we do is we connect these pioneers and have sessions for inspiration co-creation, and they are encouraged to scale it up further. And we invite the scientifics or universities to do the research, and then look together for how to come over the obstacles and to find financing. That is actually working out at the moment, luckily. And we're doing joint studies. On nature on prescription is quite simple. Simple, but that's how we do it. On local scales, we experiment to support the GPs to find spots where you can go out. The Netherlands is not the most natural country, nature-full country, as you might know, and where to go to if you want to go into nature and for specific questions on health, mental health issues. We're also looking at specifically how the areas of the mental institutions, they often have their own properties, how to create these properties in order to make them better usable for the therapies, so to say. But the main question that is keeping us busy as Nature for Health at the moment is how to accelerate all these good examples, how to make a jump, and how to really get this more going further. And therefore, I'm really happy to listen to you guys, because I hear already a lot of very interesting steps what you're doing there. It's useful for us to be part of such a community that we can work around mental health and nature. We would like to cooperate also if you with some of the projects that are here, like the EU funded projects. We're interested to participate, and I think maybe planetary health as a sort of understandable phrase to stress the importance of the reciprocal relation between nature protection and development and healthcare, that we can also gather together to put pressure and make it more of a priority in the EU and on global institutions like WHO. And for the rest, I'm really eager to hear. I'm actually more listening to what kind of great examples there are in the rest of other countries. So very short, but that was what I would like to share. Thanks.